Hello, today for my presentation is about cardiovascular disease in women. So here is my outline, and here is what is heart disease. Okay, so heart disease refers to conditions that involve the heart, the valve, and the muscle contraction, and that it's vesicle and irresponsible for muscular contractions. So the common heart disease includes coronary artery disease and heart failure, cardiomyopathy and arrhythmia, and heart valve disease. So before that, I would like to show the video.
On the Health Watch, after decades of declines, death from cardiovascular disease are on the rise again.
A new report was released today, and our Stephanie Stoll has that for you.
Yeah, not good news here, guys. You know, the numbers are huge, and they show the country has taken a turn in the wrong direction when it comes to heart disease. The study says almost half of American adults have some type of cardiovascular disease. Many Americans are not heart healthy. The new report from the American Heart Association says 48% of Americans, or more than 121 million adults, have some type of cardiovascular disease, or CVD.
Heart disease remains the #1 killer in this country of men and women. Our greatest healthcare expenditure in this country is essentially on manifestations of heart disease. Dr. Daniel Edmundowitz, the chief of cardiology at Temple University Hospital, isn't surprised by the report that says more than 840,000 Americans died from cardiovascular disease in 2016, an increase over the previous year. Even though we associate heart disease perhaps as someone with a lot of symptoms, chest pain, needing a heart catheterization or a bypass surgery, heart disease as defined by early cholesterol accumulation in the vessels not causing any symptoms happens much earlier. The increased heart disease numbers are also partly due to a change in the way high blood pressure is defined. People are now classified as hypertensive if their blood pressure is 130/80 or above. The previous threshold was 140/90. Virtually all heart attacks and strokes, this would be heart and vascular disease that people recognize. But these are, almost all of them are virtually all of them are preventable. 8 in 10 cases of CVD can be prevented by better managing high blood pressure, diabetes, and high cholesterol, getting enough sleep, and maintaining a healthier lifestyle. Good heart health also depends on having a good diet and getting regular exercise. And doctors say smoking is probably one of the worst things you can do for your heart, and the report says fewer people are lighting up. One positive trend there. It's interesting that so much of this is preventable.
Okay,
Right.
then.
So we got to
So
take better
true.
care, folks.
Good heads up. Good awareness. Thanks, Steph.
Okay, so here is why heart disease in women is different. So women are 52% more likely than men to experience a meaningful delay in emergency care, and so the aspirin therapy to prevent heart attack may have different benefits on women and men. And so there is association between heart disease and breast cancer. Drugs like anthracycline, and so female stroke patients are less likely than men to receive preventive care for subsequent strokes. So heart disease in women facts. So the fact is that we written on the wall, heart disease stand as the leading cause of death among women. So cardiovascular disease causes 1 in 3 women's deaths every year, and 44 million women in the US are affected by heart disease. And 90% of women have more risk factors for heart disease or stroke. So, and women have a higher lifetime risk of stroke than men. So, and the other thing is 64% of women who die suddenly of coronary heart disease have no previous symptoms, and 80% of heart disease and strokes events may be prevented by lifestyle and changes and education. The reason of choosing this cardiovascular disease is that because I've seen several people around me are having heart problems, and also I am learning EKG technician right now, so I would like to learn more in the heart about the cardiovascular disease. So how does heart disease affect women? So only about half, 56% of women recognize that heart disease is their number one killer. Heart disease is the leading cause of death for women in the United States, killing 578 women in 2017, so, or about 1 in every 5 female deaths. Heart disease is the leading cause of death for African American and white women in the United States. About 1 in 6 women have age 20 and older. 6.2% have coronary heart disease. The coronary heart disease is the most common type of heart disease, and so about 1 in 16 white women, 6.1%, black women 6.5%, and Hispanic women 6%, and about 1 in 30 Asian women, 3.2%. So heart disease death rates, like it is from the CDC, the death and heart disease death rates between 2015 and 2017. So the dark red spot are the highest, and so the lighter is the less, and the darkest spots are the more people, women dead from heart disease dead rate. Women age 35 plus, 31st by county. So the symptoms of heart attacks in women is that fatigue or sweating or shortness of breath or chest or discomfort, stomach pain and nausea, and pain in the arms and neck and shoulder, or neck or jaw. So sometimes men and women can be different in their symptoms. So heart disease, the heart disease risk factors for women. So smoking. So these parts can be changed, because you can, if you desire, you cannot smoke. That one is overweight, and that one is high cholesterol and diabetes. So that part is you cannot change, because it's come from the race, and it's from like family history of heart disease and preeclampsia or age. Tip. So what can women do to reduce their risk of heart disease? So tip to reduce your risk for heart disease are maintain a healthy diet, make a healthy food choice, stay active, stop smoking. So yeah, like said in the video, it's smoking is the main, maybe the main cause. So you have to know your if you know diabetes or not, like blood pressure and cholesterol level. So I think that's is for my presentation today. Thank you for watching.